Gout is a common inflammatory disease characterized by recurrent attacks of severe joint pain and swelling. It's often due to a failure of the kidneys to excrete uric acid properly, which is a breakdown of purines. Purines are found in foods such as beer, certain meats, and seafood. This is a hereditary condition, more common in men and patients with chronic medical problems, as shown here. Most cases begin at night with sudden onset of severe pain, swelling, and redness of the MTP joint of the great toe. Gout can be inferred clinically, but the gold standard for diagnosis is analysis of the affected joint fluid, which can show urate crystals. Blood work can show elevated uric acid, but it is not diagnostic. An X-ray can sometimes show characteristic erosions and tophi, as seen here. Treatment includes management of the pain with rest, ice, and anti-inflammatories. Reducing consumption of food with high purines will help. Allopurinol is a great medication to reduce flare-ups in chronic gout. Here is a list of foods to restrict with recurrent gout.